Creutzfeldt-Jakob disease, or CJD, is a rare and fatal neurodegenerative disease. It affects approximately 1 to 2 people per million per year. CJD is characterized by its extremely rapid progression, typically leading to death within months to a year of symptom onset. CJD is classified as a transmissible spongiform encephalopathy, or more commonly known as a prion disease. This means the prions from CJD cause tiny lesions in the brain, giving it a sponge-like appearance. But what is a prion? A prion is a type of protein found in the brain of all healthy humans and animals. It is completely harmless when found in its normal, folded conformation, called the PRPC. However, this prion protein can become misfolded into a disease conformation, called the PRPSC. It is this conformation that causes CJD. The PRPSC will then start a chain reaction, converting more and more PRPC prion proteins into the misfolded conformation. These diseased prions then aggregate together, forming plaques, which inevitably leads to cell death and spongiform changes in the brain, again giving it that spongy brain appearance. The cause of the misfolding of the prion protein depends on the type of CJD and is still not fully understood. There are 4 types of CJD: sporadic, familial, iatrogenic, and variant. Sporadic CJD is the most common form of CJD, accounting for around 85% of cases worldwide. This form of CJD occurs spontaneously with no known cause. However, it is hypothesized to be the result of random protein folding errors. These errors are more likely to occur with age, which may be why sporadic CJD more commonly affects ages around 60 to 65. Familial CJD is the inherited form of the disease, accounting for around 10 to 15% of cases. It is caused by a mutation of the PRNP gene on chromosome 204. It is autosomal dominant, meaning if you have the gene, there is a 50% chance your offspring will have it as well. Iatrogenic CJD is linked to medical procedures that involve exposure to contaminated tissue or equipment. Prions are able to withstand routine sterilization procedures, which can raise the risk of accidental transmission. Variant CJD is linked to the consumption of meat from cattle affected with bovine spongiform encephalopathy, otherwise known as mad cow disease. This means if you ate meat from cattle infected with mad cow disease, or BSE, you may develop variant CJD. The early stage of CJD usually presents as cognitive decline, visual disturbances, insomnia, vertigo, and behavioral or personality changes, such as irritability, anxiety, apathy, depression, and mood swings. Later stages of CJD often show myoclonus, which is an uncontrolled movement or sudden jerks, ataxia, indicating problems with coordination, balance, and gait, dysarthria, which is difficulty speaking due to muscle weakness, dysphagia, which is difficulty swallowing, vision loss, mobility loss, and severe dementia and cognitive impairments. Coma, paralysis, and akinetic mutism, where the patient cannot speak or move voluntarily, is common in this later stage. These states often lead to infections such as pneumonia, and eventually death. A definitive diagnosis of CJD can only be done at autopsy. However, there are a combination of tools that can heavily suggest a CJD diagnosis, such as MRI, EEG, and cerebrospinal fluid examinations. The presence of the 14-3-3 protein and tau protein in high concentrations in the cerebrospinal fluid can indicate CJD. Additionally, real-time quaking-induced conversion, or RT-QuIC, is able to detect the misfolded prion protein in the CSF, making it an important diagnostic tool. Unfortunately, there is no cure for CJD, nor is there any way to slow down disease progression. Most treatment options focus on symptom management and supportive care. There has been a strong focus on palliative care, as it provides support for patients and their families and can improve the patient's comfort during the disease progression. With the advancements in CJD research and knowledge, promising treatment options may soon be available. As of 2025, there is a new trial in Canada that hopes to evaluate a new treatment method using short-string nucleotides called antisense oligonucleotides. This therapy is hypothesized to stop the misfolding of the prion protein and slow the disease progression. If you or anyone you know needs more information or support for CJD, the following resources are available. For more information regarding the clinical trial for CJD using antisense oligonucleotides treatment, visit the link below.